Hey docs, it's Jerome Fryer. I just wanted to share with you some of the features of this professional LxH model. It's been crafted with more of a normal specimen because there's very minimal osteophytosis compared to the lumbar spinal stenosis model that I've developed. But this model, it's an important feature that the lumbar lordosis is still maintained compared to the lumbar spinal stenosis model, which you can see that it's in a state of flexion, and you can see the arthritic facets as a result of the stress shielding over time. Getting patients to understand neutral load is very easy with this model, and what you do is you just share with them. You can see that there's wedging because of the lordosis. There's wedging of the disc. There's about 12 mils on the front and 10 on the back, and you can get their eye oriented, the patient's eye oriented to the end plates, kind of like a sandwich, and it's open kind of on this side. And under neutral loading, it'll bulge, right? You can see the bulging there, but the nucleus remains anterior because of the wedging. Quite simple. Patients can understand that. But as soon as we get into a state where there's, where these are parallel, now you're getting into a state where it's a little bit kind of risky on pushing that nucleus posterior. And you can show them that, under a little bit more flexion, will actually open up those annular fibers just gently. You don't need to show, like a full extrusion like that. You just show them gently how it separates and spreads that annulus, which is sensitive because it's innervated. And you can show that inside here. And I've also demonstrated the neo-innervation, how it grows into that radial fissure. The surgeons, when they find this, they see it as granulation tissue. So, anyways, just an important point, and you can see that, with the lumbar spinal stenosis comparison, and the stenosis is because of the narrowed spinal canal in here, and you can see that the lordosis is gone. It's in a state of flexion. So you can talk about changes over time related to the facet joints and the hyaline cartilage that I've represented in blue. So, yeah, I hope that helps.